Mental health is an important part of our well-being, yet discussing it can sometimes feel challenging. In this video, our goal today is to shed light on this important subject by exploring the 10 most common mental health disorders. Whether it's for yourself, a loved one, or just to be more informed, understanding these disorders is a step towards empathy and awareness in our communities. Before we begin, it's crucial to note that this video is for educational purposes only. It's not a substitute for professional diagnosis or treatment. If you or someone you know is struggling, we strongly encourage seeking help from qualified professionals. So, let's begin our journey into understanding mental health better. And remember, if you find this video helpful, don't forget to like, share, and subscribe for more content like this. We begin our exploration of mental health disorders with one of the most common yet often misunderstood conditions: depression. Depression is a serious mental health condition that impacts many millions of people worldwide. It can deeply impact a person's feelings, thoughts, and behavior. Symptoms of depression can vary, but commonly include a persistent feeling of sadness, loss of interest in activities once enjoyed, changes in appetite, sleep disturbances, fatigue, and difficulty concentrating. Many people also experience feelings of worthlessness or guilt, and in severe cases, recurrent thoughts of death or suicide. The causes of depression are complex. They can include genetic factors, brain chemistry, personal history, and environmental influences. Now, let's talk about anxiety disorders. These disorders are characterized by significant worry and fear that can interfere with daily activities. First, let's understand generalized anxiety disorder, or GAD. People with GAD experience excessive anxiety or worry, most days for at least 6 months, about various things like health, work, social interactions, or routine life circumstances. Another common type is panic disorder. This involves recurrent unexpected panic attacks, sudden periods of intense fear that quickly arise and can reach their peak within short minutes. Symptoms can include heart palpitations, sweating, trembling, and feelings of impending doom. But what causes these anxiety disorders? It's believed to be a combination of genetic, environmental, psychological, and developmental factors. Next, we delve into a complex mental health condition: bipolar disorder. This disorder can include symptoms of extreme mood swings, including emotional highs and lows. Bipolar disorder affects approximately 1 to 2% of the global population and typically involves episodes of depression and either mania or hypomania. During a manic episode, an individual might feel very high-spirited or irritable, with high energy levels, reduced need for sleep, and a loss of touch with reality. In contrast, during a depressive episode, they may feel sad, hopeless, and lose interest in most daily activities. The exact cause of bipolar disorder isn't fully understood, but it's believed to be linked to genetics, brain structure, and chemistry, as well as environmental factors. Diagnosing bipolar disorder can be challenging. It often takes a detailed medical history and careful observation of symptoms over time by a mental health professional. Now, let's discuss schizophrenia, a serious mental disorder that affects how a person thinks, feels, and behaves. It's often portrayed in media, but these portrayals can be misleading. Schizophrenia is not about having a split personality. It's more about experiencing a distorted perception of reality. This can include hallucinations like hearing voices and delusions, such as believing that one is being monitored or controlled. Symptoms are typically divided into 3 categories: positive symptoms, which add behaviors not generally seen in healthy people; negative symptoms, like blunted emotions and speech difficulties; and cognitive symptoms, such as trouble focusing or remembering. The causes of schizophrenia are complex. It's thought to be a combination of genetics, brain chemistry, and environmental factors. Stressful or traumatic life events may also trigger symptoms in people with a predisposition to the disorder. Understanding schizophrenia is important for breaking down the stigma associated with it. People with schizophrenia can lead meaningful and fulfilling lives, especially with proper treatment and support. Let's talk about obsessive compulsive disorder, commonly known as OCD. This disorder is often misrepresented in popular culture as just being about cleanliness or orderliness, but it's much more complex. OCD is characterized by uncontrollable, recurring thoughts and behaviors, also referred to as obsessions and compulsions, that the individual feels the urge to repeat over and over. These obsessions and compulsions can significantly interfere with daily activities and cause great distress. For example, a person might be obsessed with germs, leading to compulsive hand washing. The causes of OCD include a combination of genetic, neurobiological, behavioral, cognitive, and environmental factors. Stress can also worsen the symptoms. It's crucial for individuals with OCD to seek treatment, as the disorder can become chronic. With proper management, many people with OCD can control their symptoms and lead full, productive lives. Understanding OCD is key to breaking the stigma and supporting those who struggle with it. Now, let's discuss post-traumatic stress disorder, or PTSD. This condition is often associated with veterans, but it can affect anyone who has experienced or witnessed a traumatic event. PTSD is a mental health condition triggered by a terrifying event, either by experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. It's important to note that not everyone who experiences trauma will develop PTSD. The reasons why some people do and others don't are complex and vary from person to person. Symptoms of PTSD are generally grouped into 4 types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. PTSD can be debilitating, but it's also treatable. Early intervention is crucial, and treatment typically involves psychotherapy, medication, or a combination of both. Understanding PTSD is crucial for providing support and empathy to those who are struggling. Remember, seeking help is a sign of strength, not weakness. Now we turn our attention to eating disorders, specifically anorexia and bulimia. These disorders are serious conditions related to persistent eating behaviors that negatively impact health, emotions, and the ability to function in important areas of life. Anorexia nervosa, often simply called anorexia, is characterized by a distorted body image and an unwarranted fear of being overweight. This leads to excessive dieting, severe weight loss, and an unhealthy preoccupation with food. Symptoms include extremely restricted eating, thin appearance, intense fear of gaining weight, and a strong desire to be thin, often coupled with denial of the seriousness of low body weight. On the other hand, bulimia nervosa, commonly known as bulimia, involves a cycle of binge eating followed by purging to try and rid the body of unwanted calories. This can involve vomiting, fasting, excessive use of laxatives, or compulsive exercising. Both disorders stem from a combination of genetic, biological, behavioral, psychological, and social factors. Stress and environmental factors also play a significant role. Our recovery from an eating disorder is possible, but it's a journey that requires patience, self-compassion, and support from healthcare professionals, family, and friends. Let's shift our focus to a widely discussed condition, attention deficit hyperactivity disorder, commonly known as ADHD. ADHD is often thought of as a childhood disorder, but it can continue into adulthood and is not limited to children. ADHD is characterized by a combination of persistent problems, such as difficulty sustaining attention, hyperactivity, and impulsive behavior. People with ADHD may struggle with time management, organizational skills, goal setting, and maintaining focus on tasks or conversations. However, it's also associated with creativity, energy, and the ability to think outside the box. The exact causes of ADHD are not fully understood, but research suggests that genetics play a significant role. Brain imaging studies have also shown differences in the brains of people with ADHD. ADHD is not a limitation. With the right support and treatment, individuals with ADHD can lead successful and fulfilling lives. Next, we're going to discuss autism spectrum disorder, or ASD. ASD is a complex developmental disorder that involves persistent challenges in social interaction, speech, nonverbal communication, and restricted repetitive behaviors. The term spectrum in ASD reflects the wide variation in challenges and strengths possessed by each person with autism. Autism is known as a developmental disorder because symptoms generally appear in the first 2 years of life. However, it can be diagnosed at any age. Symptoms of autism include difficulties in communication, social interactions, and often include repetitive behaviors or intense interests in specific subjects. The causes of autism are not fully understood, but research indicates that genetics play a major role. Environmental factors may also contribute to the development of ASD. It's important to understand that autism is a part of who a person is. People with ASD can live full, productive lives and contribute uniquely to our world. Next, let's talk about personality disorders, with a specific focus on borderline personality disorder, or BPD. Personality disorders are a group of mental health conditions characterized by enduring patterns of behavior, cognition, and inner experience that deviate considerably from the expectations of an individual's culture. Borderline personality disorder, in particular, is characterized by a pattern of intense and unstable relationships, a distorted self-image, and strong emotional responses. People with BPD may experience intense episodes of anger, depression, and anxiety that can last from a few hours to days. They may also have issues with self-image, impulsivity, and fear of abandonment. The causes of BPD are not entirely understood, but both genetic and environmental factors, such as a history of childhood trauma, play a role. Living with a personality disorder like BPD can be challenging, but with proper treatment and support, individuals can lead stable, fulfilling lives. Mental health is just as important as physical health. If you or someone you know is struggling, we encourage seeking help from mental health professionals. It's crucial to break the stigma surrounding mental health. By educating ourselves and supporting each other, we can make a significant difference in the lives of those affected. If you found this video helpful, subscribe to our channel for more informative and engaging content. Also, head over to mindstratos.com to explore helpful solutions on a variety of mental health topics. Thanks for watching. Take care of your mental health, be kind to yourself and others, and we'll see you in the next video.